This is Steinar. He has a suspicious mole. Steinar's mole is therefore removed and sent to the pathology lab, where a bioengineer prepares a sample of the tissue for microscopy. This sample is passed on to the pathologist, a specialist in cell and tissue diagnostics. The pathologist finds it difficult to determine whether the mole is benign or malignant, and decides to consult with a more experienced colleague at another pathology lab. Several days have passed since the sample was taken, and until recently, Steinar would have had to wait even longer. The microscopy sample would have had to be packaged, labeled, and mailed to another part of the country. Once there, the package would have to be unwrapped, registered, and distributed to the right pathologist. This process would take days, even weeks, and the wait would have made Steinar concerned. Luckily for Steinar, digital pathology has been implemented, simplifying and improving analyses at Norwegian pathology labs. But instead of the pathologist examining the sample in a microscope, the tissue sample is scanned digitally, and the pathologist examines the sample on a screen. This digital sample is instantly available to other pathologists, anywhere and anytime. Critical measurements are done directly on the screen. Image analysis and pattern recognition tools aid in the diagnostic process and help pathologists evaluate the expression of biomarkers, and pathologists are able to compare their diagnoses against historical data. For pathologists, digital pathology represents a considerable improvement in workflow, making it easier to exchange experiences and specialize, no matter where they work. For Steinar, digital pathology means increased security. No matter where he lives, he knows that his sample will be analyzed by a specialist who is an expert on exactly the type of mole he has. He gets results and a diagnosis more quickly, and that matters. Every year, the number of cell and tissue samples screened for cancer in Norway increases by 5 to 10%. By 2025, pathologists have to diagnose twice as many people as today. Digital pathology is the paradigm shift the field of pathology needs to ensure efficient and high-quality diagnostics and treatment.